So in addition to resources for families, let's talk a little bit more about specifically what type of therapy is available for the child who's been diagnosed with autism. ABA therapy is something that I've heard a lot about. Can you tell us more about that?
Yes, I think that's really important for families to be aware of. ABA therapy is one of the most well-studied forms of therapy for children with autism. It really targets, specific behaviors that they're trying to improve or work on. It also helps with global development as well. What we find is that families that can get formal testing through an ADOS can then go on and qualify, sometimes through their insurance company, to get paid ABA therapy in their home. So the idea is that the child is functioning in their normal environment and they have a therapist that will come in and work with them in their home. For many children with autism, it can be very intensive, somewhere between, 20 to 25 hours per week, and it can be very costly. So some of those therapies can cost, anywhere from $100 to $200 an hour. Wow. So it's not an insignificant amount of money. So for families, in order to be able to get insurance companies to pay, getting formal testing before age 8 is really important. And then we can hopefully use the insurance company to pay for those therapies. Children can also reach out and get therapies, occupational, physical, speech therapy in schools. Sometimes ABA therapy can be provided as well, depending on the particular child's situation. So any opportunity that we have to resource and reach out and access those opportunities for families in our community is really important. We're really lucky here in Davis County that since we've noticed that more insurance companies are starting to provide ABA therapy, we've had more service providers come online where we have more access for patients here locally, which has been a huge benefit for our community. And so we really want families to know about ABA therapy and understand the value that it can provide to a child so that we can get them diagnosed early and get them into services as soon as possible.
In addition to those services, what about medication? How common are medications used to treat autism, and when are they appropriate?
That's a very good question. Generally, we don't use medicine to specifically treat autism. I would say therapy is a more traditional avenue to pursue. However, there are certain behaviors that sometimes can be accompanying your autistic child's behavior. So for example, a child may become depressed, a child may become more anxious, a child may have some mood lability, and those are things that we can use medications to help manage. But the autism specifically itself, there isn't something that's going to correct that for them other than working through those behaviors and learning new skills.
And it requires the parents learning how to help the child too. So it is really, like you said, a family approach.
Very much so. Yeah. Children that have parents that are invested in their therapy and can help provide and support therapy, even when it's maybe not happening in their home or in a more formalized setting, then they can help support the development that needs to happen for that child if they're informed and educated and aware.
One of the most important things I want to leave with is the fact that even if a child has gotten a diagnosis of autism, that doesn't change the fact that they are your child that you love. And like you said, they come with so many strengths too.
Absolutely, they do.
And so it's so important to focus on those too.
Yes, I agree. I think it's important not to focus on a diagnosis in exclusion. I think it's really important to look at a child's strengths and weaknesses and view them as a whole person, because they have many beautiful talents and many beautiful characteristics that enhance families. They do come with some challenges at times, and certain things may be more challenging for an autistic child, but certainly families can derive a lot of joy and pleasure out of their relationship with that child, as well as their siblings, and they're an important integral part of a family that is not a diagnosis, but they're a person. It's really important to remember that.
I don't think we could end on any higher note. Thank you so much for taking time out of your busy schedule with us today, Dr. Strasser. A wealth of knowledge that I'm sure is going to be helpful and beneficial to everyone out there. Thanks again so much.
Thank you.